Good day, my name is Glenda Lindangan, a first-year nursing student at Central Mindanao University. In this video, I will be demonstrating the procedures on moving a client up in bed. So let's start. Prior to performing the procedure, we have to introduce ourselves and verify the client's identity using the agency protocol. So good morning, sir. My name is Glenda Lindangan and I will be your nurse for today. Ano sa pangalan, sir?
Michael Pongas.
Kano sa birthday, sir?
November 28, 2001.
Okay, so we have to do that in order to make sure that we will be giving the intervention to the correct patient. And the next thing that we have to do is we have to explain to the client what we are going to do, why is it necessary, and how he can participate. So we have to listen to any suggestions made by the client or support people. So we have to do that in order to gain the patient's trust and also his cooperation. Let's proceed. So the next step that we have to do is we have to perform hand hygiene and observe other appropriate and infection prevention procedures. So I will be using this alcohol-based hand rub to prevent the spread of microorganisms. So I'll just rub until it's dry. The next thing that we have to do is we have to provide for the client's privacy. So we have to close the door and also the curtains to make sure that our client will feel comfortable and he will feel secured while we are doing the procedure. Let's proceed to the next step. The next step is to adjust the head of the bed to a flat position or as low as the client can tolerate. This is done to ensure that the patient's comfort is being prioritized. So let's flatten the head portion of the bed. So okay na niya position, sir. Okay ka nga ka-flat. Okay, sir. Okay, thank you, sir. Now let's proceed to the next procedure. So the next step that we have to do is we have to raise the bed to a height appropriate for personal safety. This is done to ensure the patient's comfort and allows the nurse to assist the patient properly. So, assuming that there is a button here to raise the bed, so I will be raising the bed now. Okay, that's enough. Okay, now since we already raised the bed into a since we already positioned the bed or raised the bed to a height that is will provide safety to the patient, we can now proceed to the next step. So the next step is we have to lock the wheels on the bed and raise the rail on the side of the bed opposite you. So now the first thing that I have to do is I will lock the wheels of the bed. So I will be locking now the wheels of the bed. So I already locked the wheels of the bed. Now I will lift the rails at opposite me. So this is the rails and I will be raising it. So the next step that we have to do is we have to remove all pillows, then place one against the head of the bed. So sir, ato sang kwaon ka jud ang imong pillow, sir, ha. So lift lang ta gamay, sir. Ay bangon lang gamay, sir. Bangon gamay, sir, ha. And then sige, sir, mabutan lang isa ka pillow diri, sir. Sige, okay na, sir. Okay. So the next step that we have to do is we have for the client who is able to reposition without assistance, place the bed in flat or reverse Trendelenburg's position as tolerated with the client. So stand by and instruct the client to move self. So assist if the client is able to move rather without causing friction to the skin. Encourage the client to reach up and grasp the upper side rails with both hands, bend knees, and push off with the feet and pull up the arms simultaneously rather. So sir, mag-hold ka dire sa rails sir ha. Mag-hold ka sa rails kay para sa imong pagbangon. Mag-hold ka sa rails and then atong i-bend ang imong knees sir kay para na. And then sige, try daw o makaya man nimo sir no kay since minimal assistance lang man ang imong need. So try daw o bangon sir. Okay sir, balik na sir. Okay. Okay na sir. You can put your legs back in its proper position. And then now let's proceed. So that is done because that helps for positioning and to decrease the gravitational pull of the upper body. So patient can use major muscle groups to push, and placing the legs will assist with the movement and prevent skin shearing on the heels. Now let's proceed. So for the client who is partially able to assist, for a client who weighs less than 200 pounds, use a friction reducing device and 2 assistants. For a client who weighs between 201 to 300 pounds, use a friction reducing slide sheet and 4 assistants, or an air transfer system and two assistants. So for a client who weighs more than 300 pounds, use an air transfer system and 2 assistants, or a total transfer lift. Excuse me. So a friction reducing device supports the patient weight and reduces friction during repositioning of the patient. So since our patient right here only needs minimal assistance, so we can skip that part. Let's proceed. So ask the client to flex the hips and knees and position the feet so that they can be used effectively for pushing. So through that, it will be easier to move the client in bed. So now let's proceed. So the next step that we have to do is we have to place the client's arms across the chest. So ask the client to flex the neck during the move and keep the head off the bed surface. So next, use the friction reducing device and assist to move client up in bed. Ask the client to push on the count of 3. So since our client needs only minimal assistance, we can skip those parts that I have mentioned because our client doesn't really need that maximal support or maximal or greater assistance. So now let's proceed. So for the next step, we have to position ourselves appropriately and move the client by face the direction of the movement and then assume a broad stance with the foot nearest to the bed behind forward foot and weight on the forward foot. Lean your trunk forward from the hips, flex the hips, knees, and ankles. Tighten your gluteal abdominal leg and arm muscles and rock from the back leg to the front leg back again. Then shift your weight to the front leg as the client pushes with the heels so that the client moves toward the head of the bed. So sir, atong buhaton sir is kaning sa imong position sir, mag-move ta pa sa ka dito sir. Kaya para mag-reposition ka. So imong buhaton sir is to ana gamay sir. Then i-use nimo ni diri sir para mabangon ka gamay dayon mo kuan ka dito gamay sir mo. Sige sir ha, in the count of 3. 1 2 3. Sige sir, sige usab sir. 1 2 3. Okay, sir. So, comfortable na ka na, sir? Okay, thank you. Now, let's proceed. So, ensure client comfort. So, elevate the head of the bed and provide appropriate support devices to the client's new position. So, this will relax the patient and avoid patient's discomfort. So, sir, ato sa tarungan gamay, sir, ha? So, ani, sir? So, okay na nga pagka-elevate sa head nga part, sir?
Yeah, sorry na.
Okay. So, the next step that we have to do after ensuring that our client is comfortable with his new position, we can now proceed to performing hand hygiene, in which I will use this alcohol-based hand rub. And that's the end of the procedures on moving a client up in bed. So thank you very much for watching.